It's Fred here from Book Club. After hearing the class's videos, it helped me gain some additional perspectives about the relationship between public health principles, advocacy, policy, and communication in advancing health equity. An important angle to look at is the role of economic framing in public health advocacy. Public health professionals often emphasize the societal benefits of equity, but it's also important to present equity as an economic necessity. By showing the cost of inaction, things like increased healthcare costs, lost workforce productivity, and the economic drag of preventable diseases, will lead policymakers who prioritize financial outcomes over ethical arguments. This framing doesn't replace the moral case, it complements it and broadens the appeal of equity policies. Additionally, we should focus on grassroots movements in driving systemic change because while coalitions often focus on engaging major stakeholders, grassroots advocacy brings the voices of those affected by the decision making policies. Community based organizations are well positioned to advocate for culturally relevant and locally tailored solutions. Lastly, we should address the potential barriers to bipartisan support and the strategies to overcome them. While empathetic language and framing health equity as a shared goal are useful, we need to recognize that red and blue politics still drive progress. Using nonpartisan forums and shared values like family well being will show local benefits of policies to build trust across the divide. Public health advocacy must be adaptable and use calculated strategies to refine our approach to advancing health equity and continue to build momentum for systemic change. To get bipartisan support, one of the biggest challenges is to stop using the divisive language tied to social justice. Terms like equity, social determinants, and justice often carry political connotations that alienate potential allies from across the aisle. These terms, while precise within public health language, are perceived by some as aligning with partisan agendas, which will derail meaningful conversations before they even begin. To get around this, advocates need to craft messages for a broader audience and avoid polarizing language and focus on universally relatable values such as economic stability, family well being, public safety, community resilience, right? Instead of framing an initiative as addressing racial health disparities, advocates would describe it as improving access to care for all communities so that every family has an opportunity to thrive. We need to emphasize practical outcomes over ideological discussions and focus on the tangible benefits of proposed policies like reduced healthcare costs, improved workforce productivity, healthier children in schools, rather than these abstract social justice ideals. If we ground arguments in measurable impact, we can shift the conversation from contentious debate to shared goals and solutions. Another strategy is using neutral language that emphasizes problem solving rather than talking about addressing inequities. A better phrase would be removing barriers to opportunity, creating pathways to health and success. This kind of framing avoids triggering resistance while still addressing the root cause. Finally, we would elevate local champions to advocate for health equity in nonpartisan terms. Policymakers often respond favorably to messages from community leaders, business owners, and churches that meet their constituents' values. These local voices personalize the issue and show its relevance without polarizing language or concepts. By removing references to social justice and instead focusing on shared values, practical outcomes, and genuinely inclusive language, public health advocates can bridge ideological divides for bipartisan support. This approach does not diminish the goals of health equity, but makes it a universal concern that is good for all Americans, not just historically marginalized groups. Thanks.